Well, it is Breast Cancer Awareness Month, and Dr. Akiko Chiba, a breast cancer surgeon at Wake Forest Baptist Medical Center, is with us today to talk about some new research and treatment options. So good to see you. Thank you so much for joining us. We appreciate it.
Thank you for having me.
All right, so let's get right to it. What are some of the symptoms of breast cancer?
So some of the symptoms can be something you can feel in your breast, feeling lumps or bumps in your breast, or sometimes underneath the armpit. And some of the skin changes can be seen in the breast, like redness of the breast or some changes in the nipples.
All right, can we talk to us a little bit about treatment options that are out there?
We have improved treatment options now, and we know that chemotherapy is much more effective than the ones that we used to use before. And we usually start out with surgery. Some people may need radiation after, depending on what kind of surgery they had. If they had lumpectomy, which is the smaller surgery removing just a small portion of the breast, those patients would usually be recommended to undergo radiation. And if they have mastectomy, which is removal of the entire breast, they may not need radiation.
Is there anything that people can do to reduce the risk of developing breast cancer?
Some of the risks can be decreased by having healthy diet and maintaining healthy weight. We do know that about 1/3 of all breast cancer is obesity related, so having a good diet and maintaining weight could be helpful.
All right, and what about new research or treatments that you're excited about right now?
I'm very excited about one of the research from Wake Forest that we have found in preclinical studies that Mediterranean diet might increase the amount of cancer preventative bacteria within the breast tissues. So this could mean that eating Mediterranean diet, such as high amount of fruits and vegetables and nuts and fish and olive oil, could reduce the risk of breast cancer.
And for more information, where can people go?
You can go to our website at www.wakehealth.edu.
All right, good deal. Thank you so much. We appreciate it.
Thank you.